Hi guys, this is Rosalind Lewis with another episode of Rosalind's Corner, and today I have Dr. Rochelle Brandon with me, and so I want to tell you a little bit about her before I bring her on. But she was a fellow of the American Congress of Obstetrics and Gynecologists. Dr. Brandon received her BA in chemistry. She then received a doctorate of medicine from UNC School of Medicine at Chapel Hill. Dr. Brandon completed postgraduate training in obstetrics and gynecology. She is certified by the American Board of Obstetrics and Gynecology and has been practicing here in Charlotte since 1999. So welcome, Dr. Rochelle Brandon.
Thank you very much. I greatly appreciate it.
You're
Thank
so
you for having
welcome.
me.
I'm so glad you're with me today. So first of all, I know that you used to work for Atrium for many years.
Yes, yes,
So tell me, you took a break
yes.
and then you started your own practice.
Yes,
So
yes.
tell me about that.
Well, I have been practicing obstetrics since 1997.
Uh-huh.
And so what happened is, really I got older and I had some health problems. And so when you're
Okay.
delivering babies,
Yeah.
you're up all night long.
Mm-hmm.
And so I started to not bounce back like I used to, and I had some health problems. And you deliver babies, and 4 days later you'd be on call again delivering babies.
Mm-hmm.
And I just kept getting sick and not better.
Mm-hmm.
And so I have a good team of doctors and everything, and it seems that probably that workload and that call load, delivering babies and running around Charlotte in the middle of the night, was a little bit too much. And so it wasn't necessarily stepping back from Atrium, as it was a conscious decision to slow down my pace for my health.
Yes.
And so I still I have patients around here in the area that I've delivered that are going to college and that type of thing. And so I'm still in the community where I practice, but I'm just not doing the obstetrics part of it.
Yes.
And just doing gynecology.
Yes.
Now the decision to go slower and kind of get out of the corporate medicine and things like that was again for a healthcare reason, and for good health and good well-being. And so I opened my own practice. So this is a private practice, a practice that I own, that I opened, just to keep it smaller and manageable, and at a pace that I can healthily continue as I get older.
Yes, and I love it. I love the colors. I love the way you did the whole thing. You really put some thought into it.
Well, thank you.
Okay, tell me about your practice and what you offer your patients.
Okay, so this is a gynecology practice, so it's women's health, and we take care of really everything except for pregnancy. And so the focus is gynecology, and so I take care of women with abnormal bleeding, fibroids, abnormal pap smears. I do a range of surgical procedures at the hospital and in the office. I also do birth control, contraception, things like that. So it is a variety of things. I also do surgery at the hospital, taking care of fibroids. I do LEAP procedures in the office. So there are a variety of things, and really I do about everything other than obstetrics, prenatal care, and delivering babies.
So I have one other question that's
Yes.
off the map. But what do you say to women that are afraid to come to have a pelvic exam or something like that? Because there are lots of women, statistics show, that never do that.
Well, I think we have to look at not only in your healthcare, but in society. How do we manage fear?
Yeah.
Do we let fear manage our healthcare? And I would say you don't want fear to be in control of that.
That's right.
And so obstetrics and gynecology is really scary because we're always screening for cancer. A breast exam is a cancer screening exam. A pelvic exam is a screening exam. A pap smear is screening for cancer.
Yeah.
And that's a scary thing to face and look into. However, we have such good medicines, modalities, and treatments that the smart thing is to face it head on.
Yes.
And to get your exam, to get the lab test, and face things head on.
Yeah.
And catch it early. And that's how women are surviving different types of cancers these days, is for early detection. And so fear is really not your friend.
No.
And so the other thing is that I try very hard to have a welcoming environment, so that people aren't afraid.
Yeah.
And when people come, their fear was not accurate.
That's right.
And when they come, they're like, well, that wasn't that bad.
Yeah.
And so fear tells you all kinds of stories about how it's going to be, but it doesn't match reality.
Yes.
And sometimes you need encouragement from family members, girlfriends, co-workers, that type of thing to help you come to the doctor so we can see what's going on. We should not let fear be in charge of our health care.
That's right. Amen. Why did you decide to place your practice here in this community?
I grew up in Winston-Salem.
Oh.
And my parents grew up in Davidson and Concord. So I am very familiar with this area. I remember when this was a farming community.
Oh, yeah.
Poplar Tent Road was all farms. Even remember they used to hunt where University Hospital is. I remember when they built University Hospital.
Yeah.
My father remembers when they built Lake Norman. And so I moved from South Carolina, where I practiced initially, to Charlotte to be closer to my grandmother, who was sick at the time. And so this is like coming home. I've got a lot of relatives here in the Charlotte area.
Yeah.
So this is like home. And so I've watched it change over years since I was a child to now the big banking community that it is.
Yeah.
So the reason I'm located here is, one thing is home. It's familiar. I have relatives and family here. And so that's why I ended up in this community. And the north side of Charlotte is just kind of where I've been, type of thing. So that's why I ended up here. This is home. It's not like
I didn't know that.
Oh yeah. This is home. This is not like I'm moving from somewhere else. This is kind of where I'm rooted.
Okay. So what do you think makes your practice different from other practices that are gynecology centered?
Well, for one thing, there are very few independent practices anymore. So Charlotte really has two main healthcare systems, Atrium and Norvant. And a lot of practices are under that umbrella.
Okay.
And so as a private gynecology practice, I am independent from those two healthcare systems. And so that is one thing that's very unique. There are only about 3 or 4 practices in Charlotte that practice gynecology that are independent.
Oh, yes.
Okay. And so that offers a patient's choices. And so there are a lot of practices, but really you're choosing between Atrium and Norvant.
Yeah.
And so this is another aspect and another avenue that patients can see a doctor that's independent of that. So it adds choice. The other thing about this practice is that it's one provider, one doctor. And so it's a small practice. You know who you're going to see. I have a small staff, and so it's easy to build rapport.
Yes.
I'm very accessible to my patients, and that works in the patient's favor.
Yeah.
Now, of course, you know, there's one doctor, and so that if I have to go to an emergency surgery, then I have to reschedule patients. But patients really understand that so long as you spend time with them.
That's
when
true.
it's their turn and you're there for them for their emergency or their surgery, then they understand sometimes when I might have to juggle a schedule around to accommodate an emergency. But for the most part, it's a comfort to patients to know that they're going to be seeing one person. And that person's going to be organizing their care.
Okay, that's great to know. So what do you enjoy in your leisure time?
Oh my goodness. There are a number of things. Now this area of Charlotte has beautiful greenway systems, so I love to walk my dog in the greenway, type of thing. And so that's a lot of fun, a lot of exercise, and we do 3 miles several times a week and things like that. So it helps my exercise, but it's nice that we've got safe, well cared for greenways here. Not every city has that.
That's true.
And this particular area of Charlotte has some nice greenways, and so that's one thing that I like to do. But oh my goodness, I do a ton of things. In my office, I have some of my artwork, so I like to do art. I am not a professional artist or anything like that, but I do like to do some painting with acrylics, and then also I make batiks. And so I do some of those things, and I've shown those before. I have quilted in the past, and I've had quilts that were shown in the art show before. And I do a lot of crochet and things like that. I'm an avid reader, and so I do a lot of reading, and so I do a lot of that. And then I hang out with my family and friends. My parents are getting older, and so I go see my parents quite a bit and family around here in Charlotte. And so really I keep a pretty calm life.
Yes,
Yeah.
I'm glad about that.
Yeah.
I am. Well, thank you so much again for being with me today.
Welcome.
And
Thank
I
you very much for
appreciate I
having me.
learned so much about you today because this is my doctor too. So I've learned a lot about her today. And I thank you guys for listening in. And I'll see you on the other side for Rosalind's Corner.
Thank you very much.